my name is Bernice. I'm going to be asking a few questions today to see if we can evaluate what's been going on today. I do want to mention that we are being recorded. This will be just kept between me, the professor. Everything that will be said today will be completely and totally confidential.
Okay.
So can you explain to me a little bit why you are here today?
I have been experiencing some pelvic pain.
Okay. And can you elaborate more on this pain that you've been having?
It's been a constant pain, more of kind of like a dull, achy, throbbing at some points, but...
Okay. And have you noticed it's just all day, every day? Is it certain times of the month?
The constant pain's pretty much all day, every day, but it does worsen a little bit before my period and during my period.
Okay. Have you sought medical professionals?
I have. I started with my primary care provider, and I had lab work done the week before, and he said everything looked good there. So we ended up doing an ultrasound, and the ultrasound ended up coming up with just calcifications inside the uterus. But other than that, they said that everything looked fine, everything looked normal.
Okay. Any life changes that could have contributed to those calcifications?
I had a D&C done with my miscarriage, which took place in April of 2017, so that was fairly recent.
Okay. Besides that, any other major life changes that could have contributed?
I was diagnosed with breast cancer in November of 2015.
Okay.
I ended up going through the whole chemo, radiation, and surgery, and like a whole year of hormonal treatment. So that was a pretty big life change.
Right,
Mm-hmm.
no doubt. Okay. And where have you gone from getting the ultrasound? What is like the current treatment that you're seeking, or what options have you been given?
Okay. Well, I've been taking a birth control, and I choose to do an oral contraceptive.
Okay.
And because we've been talking about my pain being related to my periods, what we're going to try is skipping my periods altogether.
Okay.
So I'm using the oral contraceptive, skipping that last week, and then just jumping right into the next pack.
Okay.
So that's one option.
Okay.
There's a couple that we're going through. Because this is now going through my OBGYN. She's also suggesting that I'm staying in contact with my oncologist and making sure that my cancer doctors are aware of what I'm going through as well, to see if this could be related to all the chemo drugs that I was on as well. Because her other thought is that it could be related to my bladder and the chemo drugs filtering through my body and having it basically destroy like the lining of my bladder. Because I also get the pain when my bladder is full.
Okay. With that being said about your bladder, have you noticed any changes in, are you constantly using the restroom? Do you go less often? Have you noticed any changes with that?
I feel like the frequency is still the same.
Okay.
I do remember when I had my blood work done, when I first went to go to my primary care, that they said that they saw blood in the urine.
Okay.
But I personally have not been able to pick up or see any blood in the urine.
Okay. With that being said, have you sought out any treatments for this bladder lining type of thing?
My OB has actually suggested I do 2 different tests.
Okay.
One with the bladder. I can't remember exactly what it is, but there is a test that we can do to see if it is affecting the lining of the bladder. The other test that she's suggesting is to see if it's endometriosis.
Okay. And what are your thoughts on those tests?
They honestly make me a little nervous. So she had brought this up the first I think it was about 3 weeks ago when I had my appointment with her. She brought
Okay.
these up and I told her, is there anything that we can try before we just jump into doing these tests? So that's why we're trying the skipping of the periods first and getting in contact with my oncologist. And then a couple diet changes related to the bladder as well.
Okay, and what type of diet changes have been recommended?
Definitely more fruits and veggies and keeping protein in the diet. There's a few foods to avoid, like caffeine is something that I'm supposed to avoid. But most of the foods that were on the list were things that I felt like I didn't eat often or like on a regular basis.
Yeah.
So for the most part, I feel like it's going to be okay.
Okay, and have you started these diet changes?
Sadly not, especially with the whole caffeine purpose. It was school, and I'm just really stressed with the amount of work that I put on myself this semester.
Right, okay. Have you been seeking any other type of medical assistance for, coping with stress or, anything like that?
My primary care provider, because I'm also prone to anxiety and depression as well, I've been seeing a therapist every 2 to 3 weeks, depending on how our schedules line up.
Okay.
I personally feel like we're kind of like at a dead end in our therapy, because I was doing like this behavioral cognitive approach where we're working on building stronger habits and making me feel like I'm more confident and like making sure that I'm taking better care of myself. And I feel like I've grown a lot because I've actually been seeing a therapist for probably the last, basically since I was diagnosed with cancer.
Okay.
So I've grown a lot just in the last couple of years of therapy.
Okay, very good. Are you still seeing one today? Is that what it sounds like?
Yeah,
Okay.
Sadly I've gone through like 4 different therapists because I've moved around so much within the last couple of years. But I'm still seeing a therapist.
Okay, and you felt like that's been for the better?
It is, yeah, definitely. It gives you somebody to talk to.
Yeah. Okay, very good. Have you sought out any treatments as well for your depression or anxiety, medications?
I do take a medication. Effexor is the name of it. We've been playing around with the dosage a little bit over the last few months. I feel like I am finally calming down a little bit. Towards the beginning of the semester, I would have some panic attacks that I would go through. But now that I'm getting a little bit more in the semester, it's slowing down, and we've upped the dose a little bit.
Okay. So I'm going to start wrapping up this interview and kind of summarize what you've been telling me thus far. So it sounds like you've been dealing with this for about 3 to 4 months. The constant kind of a throbbing pain, but it does worsen closer to your period than during your period. But for this, your doctor has recommended an oral contraceptive, the birth control, and trying to skip that placebo pill, the sugar pill, and jumping into a new pack, trying to skip your periods to see if that helps with the pain whatsoever. And it also sounds like you're kind of in the middle, in like a limbo state of kind of what to do next, what your next treatment option is. But it does sound like you've been seeking, OB/GYN, your oncologist, as well as your primary care physician. And then also, kind of on top of that, the therapist and kind of helping you cope and kind of stay on top of things. Is there anything that I missed or anything you would like to add?
No, I think that sums it up.
Okay, then I think we are going to conclude with our interview. Thank you for taking the time to see me today.
Thank you.